Wouldn't it be really cool if a patient or client walked into your PT clinic, your office, or your gym, and before they even moved, you knew exactly what their problem was? I know. Probably sounds too good to be true. I get it. But what if I were to tell you that it's actually not? And there's actually a way that you can do this. What if I also told you that you actually do this with other things in your day to day life every single day in a subconscious way? In this video, I want to talk about how we can really understand movement patterns. And we can also consider movement dysfunction when a patient walks in, goes on the PT table, or whatever you are doing for your assessment. You can understand exactly what that person's going to need and exactly what to look for. Let's jump into it. Once we can raise our level of awareness, we can change this complex movement thing into something more simple and provide and give us a system to follow to increase our chances of success. So as you see, we have a skeleton here. Before we jump into the human being, let's understand how we do this in our day-to-day lives. If I told you to think about a Lamborghini and a smart car, what happens? Sure, you think of a Lamborghini and a smart car, but whether you realize it or not, you are subconsciously creating expectations because of their structures. The structures of those two cars produce expectations that you expect to see. For example, you are going to expect a Lamborghini to be fast, terrible on gas, really expensive, really fun to drive. On the other hand, a smart car, a two-door smart car, you're thinking not as fun as a Lamborghini, more practical, better on gas, not as expensive. So you see, the structure of those two cars create expectations that you're going to see. Now let's look at another example. Consider the two different body types of a marathon runner and a sprinter. Two totally different structures, and they place two totally different demands on their bodies. Wouldn't you expect a sprinter to have increased muscle mass, run faster, not be able to run that long distance? Of course. In our marathon runner, you would think decreased muscle mass, increased endurance. Maybe they have different training styles, right? But based off the two categories of the human beings, you're starting to understand what you would expect to see. Let's go one more example. Think of a quarterback and a linebacker. Two different structures that are producing two different expectations when it comes to movement, how they look, their agility, their speed, all of these different variables. So, like I said, you're doing this all the time. Why aren't we doing it for our patients that are in pain? Well, maybe it's because we're not aware of the two different structures of the human body. That's where we jump back to our skeleton here. Just like we saw with the car example, the runner example, and the football example, when a person comes in based off their structure, we could start to expect certain types of movements. How does this work? Well, essentially, the structure is either going to pull their center of mass forward or pull their center of mass back. That is going to produce certain expectations because of what is going to slacken or tauten various structures throughout the whole body. So let's jump into the two structures so you can really start to understand this the next time you're performing an assessment. As we consider the whole category of structure, we need to remember three key things: rib cage, pelvis, and center of mass. Just like we saw with our examples, the structure of the car creates certain expectations. When patients or clients come in, we need to start thinking about what does their structure have from an infrasternal angle standpoint. Is it greater than 90 or less than 90? Let's start with greater than. Greater than 90 at this infrasternal angle will have an angle that's more like this, almost more horizontal, and it's more of a barrel-chested, flared rib cage presentation. That's the rib cage. What happens at the pelvis? Usually the pelvis is in internal rotation, and it's going to produce a center of mass that's pushed forward, so an anterior center of mass. So we can start to connect the dots just like we did with the car. A Lamborghini's fast, not good on gas, really fun to drive. A wide infrasternal angle is a barrel-chested, internally rotated driven, anterior center of mass individual. Conversely, when you have a less than 90, a narrow infrasternal angle here, it's also going to produce certain expectations. The rib cage is more depressed. The pelvis is usually more posteriorly, externally rotatedly driven. That produces a posterior center of mass bias. Just like our smart car, we know it's going to be less expensive than the Lamborghini. It's going to be less fun to drive than the Lamborghini. And it's also going to be more fuel efficient. Now, just like with our narrows, we could start to expect them to have certain positions at the rib cage, movement expectations at the pelvis, and center of mass expectations. This is how we start to really get confident with our assessments, understanding movement patterns, and then understanding how to properly program the individual. Now, the next question you might be asking yourself is, how do I actually identify this? Well, we talked about the first way, and that's actually looking at this infrasternal angle, getting hands-on, understanding, are we narrow, are we wide? Second, as we go through our movement assessment and our table tests, we want to start to increase our awareness on what the actual pattern of the whole test is showing. For our wide, greater than 90 infrasternal angles, they're usually going to have better internal rotation measures compared to external. So we're thinking hip internal rotation. We're thinking straight leg raise, hip adduction. Conversely, our narrows, less than 90-degree infrasternal angles, are better at external rotation bias tests. So this is hip flexion, hip external rotation, hip abduction. Lastly, we can visually start to inspect their overall posture. Are they standing in more of an anterior pelvic tilt? Are they in more of a posterior pelvic tilt? What does their thoracic spine look like? A posterior pelvic tilt increases thoracic kyphosis, whereas an anterior pelvic tilt increases lumbar lordosis. So those are three ways that we can start to identify how our person is moving, what their problem is, and then to fix it, we just need to get them good at what they're bad at. Individuals that are driven to an anterior center of mass are craving a little bit of a posterior center of mass. Individuals that are living in a posterior center of mass are craving a little bit of an anterior center of mass. What is this doing in the most simplest terms? Increasing movement variability. When we increase someone's movement variability, that's how we start to increase their range of motion, increase their movement capacity, and they stop compensating because now they have more movement or more range to move through. As a quick recap, to understand your patient's patterns before they actually move, we need to start thinking of three key things from a structural standpoint. What position is the ribs in? What position is the pelvis in? And where is their center of mass bias towards? Once we can understand that, we can start to expect them to be better at certain motions and not so good at certain motions, just like we do with other categories and examples that we talked about in our everyday life. To start to increase their movement variability, we just need to get them towards the opposite way. Now, it's definitely easier said than done. So, if you want to simplify this and learn exact principles, exact exercise, exact strategies, so you could start to increase your confidence from your assessment standpoint, but actually start getting your patients better results, then I would encourage you to check out the Clinical Coaching Foundations course. This is a program that reframes and redefines the standard of physical therapy care. I will leave the link in the description below so you can check it out. You can sign up through there. If you have any questions, leave them below in the comments.